everyone, Ali Severino here, bringing you a new video from Addiction Helpline America. If you don't know, Addiction Helpline America is your one-stop shop for all addiction treatment resources on the web. If you or a loved one are seeking treatment, just go to addictionhelplineamerica.com, click the state that you're living in, and you'll be shown all of the resources near you for all the tools and knowledge that you need in choosing the correct treatment facility for yourself or a loved one. Please go to addictionhelplineamerica.com. Today's video, we're going to be giving an update on COVID and how it has affected mental health and substance use in the United States. So I have a bunch of data for you guys, and honestly, I knew that, obviously being stuck in your house, any kind of lockdowns going to negatively affect a lot of people's mental health. Losing their jobs, not being able to go to school, all of these things are going to impact our mental health as a society. But doing the research and looking up some of these statistics, it's really jarring how much these lockdowns and COVID in general has affected mental health of our neighbors and ourselves. So let's go through some of these statistics and talk about some of these impacts that this pandemic has had on everybody. And also at the end of the video, we're gonna go through some mental health tips and some regular health tips that I don't see shared enough on how to stay mentally and physically healthy during this time. So one topic that I wanted to definitely talk about in this video when it comes to stats since this pandemic has started, and that is drug overdoses. Unfortunately, last year we had the highest drug overdoses ever. It was the highest recorded year, which was followed, the year before that, 2018 was the first dip that we actually had in drug overdoses in years. It was the first time that drug overdoses went down. The next year last year, 2019 was the highest ever recorded year for overdose deaths. But since the COVID-19 pandemic, really overdoses have skyrocketed. In my opinion, that could be because people are maybe buying from new dealers that they don't know. Maybe they're turning from prescription painkillers to street drugs because maybe they can't go to see their doctor, or they can't afford them because they've lost their jobs. Maybe they've lost their health insurance and can't afford to get their medications filled at the pharmacy. So there's a lot of different things going on here. But one thing that really stuck out to me was drug overdoses killed more Ohioans, so people from Ohio, in May than any month in the last 14 years. Guys, the last 14 years have been devastating as far as drug overdoses go, especially in Ohio. That is just unbelievable. Even more of a reason to get Narcan. You guys can get Narcan by going to either Walgreens or CVS. You don't need a prescription. All you have to do is ask the pharmacist and they will get it ready for you. Hospital emergency department visits from opioid overdose have increased 42% from April to May. So from April to May, people going to the emergency room due to some sort of opioid overdose increased 42% across the country. Beyond this 42% increase of hospitalizations due to opioid overdose, 54% of organizations have had to close programs and 65% of organizations have had to turn away patients during this pandemic. And this is from a survey from the National Council of Behavioral Health, who I am certified through. Thank you very much. So 54% of these organizations have closed their doors, and at the same time, there has been a 50% increase of people requesting and needing services from these organizations. And according to the CDC, 40% of Americans report struggling with mental health during this pandemic. Moreover, on mental health, I wanted to talk about death by suicide, which is the 10th leading cause of death in America. And 1 in 4 people ages 18 to 24 seriously contemplated suicide in June. 1 in 4 18 to 24-year-olds, a quarter of our young people. Like I said earlier, there was a 40% increase in adults saying that they were struggling with mental health or substance use. Anxiety, depression symptoms were up 31%. Trauma or stressor-related disorders were up 26%. 13% of people started or increased substance use, and 11% of people seriously consider suicide. Beyond illegal drugs, beyond death by suicide, beyond thoughts of suicide, alcohol. Alcohol sales have risen by 243%. That is a staggering number. 243% increase in alcohol sales in the United States. If you watch my videos, you know that alcohol is the deadliest drug out there. It kills more people every single year than all of the other drugs combined besides tobacco. And, this is really, really staggering. Alcohol is one of the 2 drugs that you need to have a medical detox inside of a detox hospital-like center. It is the one of 2 drugs that you can die from detoxing off of. It causes so many health problems and it makes you more apt to get sick, and it's just really crazy and it's sad, and it is a idea of how badly people are hurting. Now that we've gone over all these super depressing statistics, so let's talk about some positive things. Let's talk about how we can turn this around, and let's talk about what we can do to be healthier physically and mentally, not only for ourselves but for our neighbors, and to lead by example. First of all, stay active. Avoiding large crowds doesn't mean avoiding nature. If you live by the coast like I do, go to the beach, go to the mountains, go to the nature preserve. I just got lost in a nature preserve literally like 3 days ago. It was super fun. Go outside, get some fresh air, go for a walk. You don't need to become a 5-mile runner overnight, get your body moving, especially if, like me, you're working from home all day. So stay active, get adequate sleep. I know for some people, especially if you're not working, if I'm not working, it totally throws my routine off and I will stay up all night binge watching a TV show. Try not to do that. Keep your routine, go to bed, wake up, do your chores, etc. Diet and nutrition are super important. For me, I started taking a bunch of vitamins in the beginning of COVID, things like zinc, vitamin D, woman's multivitamin, and I take a tablespoon of elderberry every single day. It's really important to get those whole foods, dark leafy greens, oranges, tomatoes, fresh herbs. All those things have tons of minerals and are rich in vitamins and fibers that your body needs to be optimally running at its best. Self-care and overall wellness is also super important. If you want, take the time to meditate. There are so many different meditation apps and yoga apps that I downloaded during the beginning of COVID that I still use today. That is pretty cool, I think. Extra stress, extra anxiety, all that stuff really weakens your immune system. So if we're not mentally well, physically, it still affects us. So it's really important to not only take care of yourself physically, but mentally as well, because you don't want to get sick. Period. Flu season is coming regardless of COVID. It's important to stay healthy. Now with COVID, telemedicine is so widely accepted and able to be utilized. Totally utilize telemedicine. Call your therapist over the phone. They have different apps if you're in recovery. Sober Buddy is one of them that I have downloaded, but there's a multitude of different apps so you can talk to people. They have so many Zoom AA meetings. If you guys are in the program, AA or NA, they have a bunch of Zoom meetings. Smart Recovery too. They have online church. I always go onto Facebook and kind of look through the events that they're having, and there's always a bunch of really cool online events. So if you don't want to leave your house and you want to stay home, you can always interact with people like that. Camaraderie is so important. In my opinion, addiction is really a form of disconnection. It's so important for me to be connected to my family and the people that I love. I think that's really important for everybody. So many cool things out now that you can do with your friends and family over the phone, over the computer. And, if you can, see them in person, taking all the precautions. And this is me not telling you all the things that everyone's been shoving down your throat for 6 months now. We all know, wash your hands, wear a mask, don't go near people, don't do this. You guys know all the things that you can do, but there are so many more things that I feel like I don't hear anyone talking about enough. Since COVID started, I don't think anyone's told me to sleep 8 hours a day, drink enough water, and take my vitamins. Because I promise you that will have so much more of an impact. God forbid, accidentally get COVID, your body is in such better shape to fight it off and keep you well if you have been having a steady, healthy diet, steady, healthy sleep schedule, you're hydrated, and you're feeling good mentally. So guys, I just wanted to show you all the really cool apps that are out there right now. Like for mental health, for instance, there's so many apps where you can just chat with somebody over the app using your insurance or your Medicaid or your Medicare. There are some really great yoga apps. Me personally, I downloaded one during the beginning of COVID and I am like a yoga pro now. This one is the one that I downloaded, the daily yoga, and I really, really like it. There's some really cool meditation apps. Headspace has been really popular and they actually have some sort of promo going on. I talked about it in my last video. Also, Sober Buddy, super cute virtual recovery coach. I don't know why, I just love his little blue, fluffy hair so much, but I think it's kind of cool. And then I found this other app just the other day. It's actually called Lucid.
And that's supposed to be a really, really cool kind of like community-based recovery app as well. So hopefully some of this helps you guys out if you didn't know that these apps were out there. I hope if you guys need them that you take the time and check them out, and I hope they make a positive impact in your life like they have mine and help you stay mentally and physically fit during COVID.
If you or anyone you know is struggling during this time, Addiction Helpline America is always there to help. You can always find us on Facebook or here on YouTube or go on our website, addictionhelplineamerica.com. If anyone you know is struggling with thoughts of suicide, they can call the National Suicide Prevention Lifeline, which is 800-273-8255. I'll also link that number down below. If you or someone you know is struggling with domestic violence, I'm also going to link a number for that down below. Hopefully I can give you guys enough resources to get you through this tough time. If you think of anything that I forgot when it comes to staying healthy, please comment them down below. Together we are better, so take care of your neighbor and take care of yourself, and I love you all. Bye.